Hi, I'm Dr. Girish Rao. What are dental implants? Today, dental implants are revolutionizing the way in which a tooth replacement is being done. Whenever a tooth is missing, we have multiple options to replace a tooth. The simplest, which was the traditional one, was where a removable denture was given. You had teeth which were made of acrylic, which is plastic, and you had a plate to which it was attached, and that used to take support of an existing tooth, or if all the teeth were missing, we were making what were called as removable dentures. Then came an era where a fixed option came in, where we had what are called as bridges. And in bridges, we were cutting two adjacent teeth, which were healthy teeth. We would cut them into a small stump, put a crown on top of both of them, and then add a fixed tooth to these two crowns. So that is why it was called as a bridge. But the biggest disadvantage of a bridge was the fact that we were cutting two good teeth, and over a period of time, the fact that we had put these crowns on these two teeth and that carried another extra one or multiple teeth, that would get decay below these teeth because of marginal leakages, and you would end up losing multiple teeth. Today, the simplest solution, which is probably the most effective solution, is directly when a tooth is missing or you have lost a tooth, to fix a screw made of titanium. Titanium is the only metal as of today wherein when we bury it into the bone, there is a process called osseointegration. This metal gets accepted by your bone and the bone heals to the metal, which is called as osseointegration. And once the metal is integrated into the bone, we can fix a tooth or a crown directly to this, and that is which is called as dental implants. How is a dental implant done? It's a very simple procedure which we do. Most of the times it is under local anesthesia, and a lot of times what we do is when a tooth is pulled out itself, into the same socket itself, in the same day we fix a dental implant into the socket. However, if the tooth has been pulled out earlier, then we have to make a small hole in the bone and we drop these implants in. So this is a very, very simple surgical procedure, by and large done under local anesthesia. In extremely rare cases, we might even take you into the hospital and do it under general anesthesia. But by and large, majority of the times, it is done in our offices under local anesthesia. You walk into the practice, get the implant done, and go back without any issue. Who requires an implant? Anybody who has lost a tooth, we can place an implant. But the most important thing is your health should be in good state. If you have medical issues such as uncontrolled diabetes, or for cancer if you have undergone radiation or chemotherapy, or if you are on certain drugs which might cause density of the bone, the bisphosphonate group of drugs, then we are very cautious about doing dental implants. But if you are a well-controlled diabetic, you are a non-smoker and you are healthy and there is enough amount of bone, then you are a candidate for dental implants. Is there an age restriction for undergoing a dental implant? Generally, in a child, when you are in the growing phase, when the jaws are developing, we generally don't do dental implants. However, there are extreme cases where you have lost a permanent tooth, you can still consider putting an implant in an adolescent. But in an adult, there is really no problems at all. Extremes of age, when we are talking on the other side, when you are in your 70s, 80s, 90s, when you have lost your teeth, if you are in good health, then there is no restriction. My oldest patient on whom I've done a full mouth implants, that means that we have replaced all their teeth with dental implants, putting in 12 implants, is a 94-year-old gentleman, and he is today 98. So it's 3 years since I've done it. So age is just a number as long as you have good health and good bone. A lot of patients come to us wearing dentures for many years. In the initial phase when a denture was delivered, it's very, very firm. It stays in position. But with use, a few years down the line, because of the resorption of the bone, the dentures become very wobbly and sometimes it falls. And there is a possibility that when you're speaking or when you're chewing, you may not be able to use a denture. Now, an implant is a great solution for these kind of patients, wherein You put just a couple of implants. We can just put 2 implants or 3 implants in each jaw, and we can clip these dentures onto that. That's called as an implant over denture. The other solution, which is a better solution, if the quantity of bone in your jaw is good, then we do what is called as a full mouth rehabilitation. So this is where we basically fix 6 implants or sometimes even 4 implants. It's called as all on 4 concept. Based on this, we can give a full jaw replacement with teeth. So that is something which could be a transformation, a life-changing experience for somebody who has had very, very loose dentures and they're struggling in their life. Now for them, an implant over denture or an implant full mouth rehabilitation is a great solution.